Now to the crisis at New York's nursing homes, where a shocking number of people have died. Well, today the governor and mayor revealed how they're planning to help. CBS 2's Lisa Rozner has this.
This FaceTime is what a daughter fears is the last time she'll speak to her mother. She says she caught COVID-19 at the Grand Rehabilitation and Nursing Facility in Whitestone. The loved one says short staffing has led to some residents not getting food or meds. But the nursing home administrator denies those allegations. The state says 6 have died there.
I'm fighting for her. It's like, I'm trying to keep her alive.
The loved one says an outbreak began after patients were transferred there from New York Presbyterian Queens, though the hospital won't confirm or comment. The state is requiring nursing homes to admit hospital patients that are medically stable. Monday, Cuomo said he was not aware of the policy, but today announced homes that can't provide adequate care must transfer the patient or call the Department of Health. He also said homes are required to notify loved ones and residents of a COVID-positive case or death within 24 hours, and the Attorney General will investigate. Those who don't comply will get a fine or have their license revoked. This comes as New York State has more than 3,500 people in nursing homes and adult care facilities that have died. That's almost a quarter of the state's total COVID fatalities. The hardest hit facility is the Cobble Hill Health Center in Brooklyn, where 55 residents have died. There's been more than 40 deaths in at least one facility in Queens, the Bronx, and Staten Island, and Mary Manning Walsh in Manhattan has lost 32. A week after we asked the mayor if he'd send extra medical personnel to help, he announced he's dispersed more than 400 clinical staff to 40 nursing homes citywide and additional protective gear. As for why the delay,
it's a part of the equation that we've had to learn in a new way to actually be able to be helpful.
One attorney I spoke with said New York does not have a law requiring certain levels of staff at nursing homes, which has led to this crisis.
Unfortunately, nursing homes, and this goes back prior to the current health crisis, are notoriously understaffed.
And it's not clear how much more emergency staffing will be needed to now save the state's most vulnerable residents. In Queens, Lisa Rozner, CBS 2 News.
Now, the Attorney General has created a hotline and a website to take complaints on nursing homes. It's at our website, cbsnewyork.com.